Your Excellency, Mr. Kutesa, President of the General Assembly, Mr. Secretary General, Excellencies, ladies and gentlemen, I am very pleased to be with you again today to update you on progress in the Ebola response 5 months since we welcomed the establishment of UNMEER. Since my briefing last month, there has been further considerable progress in the response. As the Secretary General noted, we have reason to believe that the worst of the outbreak is behind us. I am speaking to you today from Liberia, where progress has been particularly remarkable. The number of new cases per week has decreased from several hundred only a few months ago to a few than 5 cases per week for several consecutive weeks. On average, there has been less than 1 confirmed case per day in 2015, with cases in recent weeks all isolated to a single chain of transmission in Montserrado County. In view of such progress in Liberia, we are now pursuing the redeployment of some UNMEER resources and capabilities to bolster surge effort in Sierra Leone and especially in Guinea. In Sierra Leone and Guinea, we also saw an overall significant decline in the number of new cases in January. Since then, however, weekly cases incidence has increased, demonstrating that progress in fighting this outbreak will not be linear and that there is a need for constant vigilance to ensure sustained progress. In Guinea, the epicenter of the outbreak has shifted to Bas Guinea, adjacent to Conakry, while in Sierra Leone, incidents continue to be greatest in the western district of Port Loko and the capital, Freetown. In both countries, targeted efforts are being pursued to further reduce the number of cases as well as geographic dispersal and to strengthen active surveillance to ensure that new cases emanate from registered contact lists. But I take this opportunity to congratulate President Johnson Sirleaf, President Koroma, and President Conde for their leadership during this very difficult time of crisis where leadership is often very much challenged. Excellences, Monsieur le Président,
Your Excellencies, Mr. President, ladies and gentlemen, while recognizing the progress that has been made in tackling the Ebola virus, we cannot, however, sit on our laurels. The impending rainy season means that we will have complicated challenges and will lead to an increase in the prevalence of other diseases such as malaria, which may mask suspected cases of Ebola. It may also mask the emergence of new cases of Ebola and significantly affect our capacity to access affected communities. These factors will compound the need to urgently control the epidemic in the next 12 weeks. The UN system through UNMEER is looking at the developments in the epidemic, and our epidemiologists are going to the more remote areas, and we are having a more flexible response, and we are further stressing rapid action to detect cases as early as possible and find a few cases in many areas. Against this backdrop, before the rainy season, we are redoubling our efforts to put people on the ground and to provide basic surveillance and to ensure that we can intervene in each district. And this means that we can quickly identify and isolate new cases and prevent a new outbreak. Over the long term, this reaction capacity can also be used to strengthen resilience in the health sectors in affected countries and pave the way for gradual transition of UNMEER in its immediate responses to the outbreak. Now, although we have made significant progress, we still have huge challenges with respect to active surveillance, case management, and the communities must be properly engaged in Guinea and Sierra Leone. First of all, there has been great success linked to changes at the community level. And wherever communities are involved, we have seen impressive results. However, denial, distrust, and the lack of understanding continue to create resistance in certain pockets and lead to dangerous practices that can probably promote further outbreaks. If we step up our efforts to mobilize communities through a more localized approach, we can probably win over the communities and facilitate access and build resilience. Even in unaffected areas, we must ensure that communities are involved so that we can actively provide surveillance and prevent further transition. In Guinea, the rise in new cases does not necessarily mean that there are more cases of transmission, but rather better action at the community level. I just came back from a 4-day mission in Guinea, where I visited several areas, and the progress in Guinea Forestier show clearly that Guinea can overcome the major epidemic that we are seeing in Forikaya, Koya, and the Conakry belt. However, if we are to reach these ambitious targets, we must have major surge efforts in communities and support from international partners for the very committed government of President Condé. Secondly, the geographic scattering of cases of Ebola and the people in the districts, as well as the porous borders, makes it necessary for all districts to be equipped with surveillance equipment and intervention capacity so that they can prevent cases from spreading. We have laboratories and we can provide case management in affected areas, but we must ensure that we have sufficient geographic coverage of such capacities. Third, since the number of weekly cases is falling and we are trying to find affected persons to contain transmission, we must step up such efforts, and we must ensure that any new cases are registered so that there is no transmission chain. Efforts are underway to strengthen searches for contacts and to prevent the spread of the disease in all the districts where we have registered such cases. We're still facing problems in terms of mobility when it comes to accessing remote areas and to provide surveillance in those areas, and we're seeing this more difficult as the rainy season approaches.
Gentlemen, allow me to update you on support from our regional partners who continue to play an important role in our efforts. The Special Envoy and I were in Addis Ababa during the last African Union Summit held talks with our partners, including the chairperson of the African Union Commission, Dr. Nkosazana Dlamini Zuma. The chairperson convened a stakeholder conference on Ebola, which I joined her in co-chairing. The workshop was well received, and the support of the African Union, particularly through the contribution of over 800 health care workers from the African Union support to Ebola outbreak in West Africa, has been crucial. During a summit of the Mano River Union on 15 February in Conakry, Guinea, the President of Guinea, Liberia, and Sierra Leone collectively validated the strategy framework step that the Special Envoy and WHO developed. UNMEER has been supporting the affected government to implement this strategic framework. The President have called on UNMEER and all partners to accelerate our efforts and support them to achieve zero Ebola infection within 60 days, effective 15 February 2015. Excellency, Mr. President, ladies and gentlemen, UNMEER has also concurrently started planning for the time when national government and UN agency funds and programs no longer need our support. If the epidemiological situation shows that we have been successful in our surge effort over the next few months, then the time also draws near for us to begin a phased transition in which we will transfer UNMEER's function and capabilities to national government and UN partners. This transition must ensure a gradual, seamless, and coordinated process that UN country teams can continue to support the nationally led response effort and be based upon clearly defined thresholds in terms of both the epidemiological situation and existing national and partner capacity. Just as the outbreak and the response in each country has varied, so too must this transition be tailored to country and district-specific exigencies on the ground. Since the countries are in different phases of their response, UNMEER may also need to redeploy its capabilities to other countries where the outbreaks has not yet been brought under control. It is critical to transfer operation carefully through a planned and coordinated transition to consolidate the gains that we have collectively made and to leave no voids behind. As UNMEER scales down, the UN agency funds and program will scale up and support the affected countries in reaching 0 new cases of Ebola and then in re-establishing essential services and commencing reconstruction and recovery efforts. Important efforts are already well underway to support the safe reopening of non-Ebola health services, including through the decommissioning of some Ebola treatment units in Liberia, as well as the resumption of education services. As schools and universities reopen, it is important to acknowledge that there is a risk that some contact tracers, very often teachers and university students, as well as medical students currently engaged in managing Ebola response center, will return to their normal function, adversely affecting response activities. It will also be important to ensure that cash payment to Ebola response workers are not abruptly interrupted and that capacities, where possible, are reoriented to support the transition into reconstruction and recoveries. Excellency, Mr. President, ladies and gentlemen, UNMEER's relevance comes from making ourselves irrelevant. The sooner we work ourselves out of the job, the better for the people of West Africa. For now, let us focus on this core work ahead. We must invest all our efforts and energy into surging the response and increasing impact through integrated surveillance, case management, and community engagement effort ahead of the rainy season, when seasonal epidemics of malaria and road closure will impede operations. The people of West Africa have never confronted Ebola on this scale before. In spite of this and the challenging conditions they faced, their efforts have stemmed the disease and prevented the worst-case scenario we all feared. I share the objective of getting to 0 transmission that President Alpha Condé of Guinea, President Ellen Johnson Sirleaf of Liberia, President Ernest Bai Koroma of Sierra Leone have declared on 15th of February. In this regard, I reaffirm UNMEER and my commitment to the President that UNMEER will support them with their national and regional plan. We have important work ahead to reach this objective and to ensure that we have collectively put in place the systems, capacities, and mechanisms to sustain this progress so that these gains can be leveraged for longer-term reconstruction and recovery processes. I continue to be humbled by the task entrusted to me by the Secretary General in heading UNMEER, as well as by the resilience of the affected countries, the courage of national and international responders, the powerful mobilization of regional actors from the African Union to ECOWAS to the Manu River Union, and by the collective solidarity you have all demonstrated through your generous contribution. I congratulate His Excellency Mr. President Kutesa, President of the General Assembly, for his personal leadership and commitment to end this crisis. I ask you to continue to stand with us through this decisive period. Thank you very much.